Nikki over the last week, actually.
Okay.
I'm in London. I'm a women's health coach, and I've heard of Nikki's work, and I was really keen to listen to her wisdom and learn some more to support my work, and just keep learning. So
Awesome. Okay, perfect.
Glad to see you made it.
Yeah, I had to ask my relative in India to purchase the ticket for me because I don't have an Indian card. It didn't accept international cards. So, but that was easily done.
There was a glitch from our end, so sorry for that. I mean, we are
okay.
Kind of learning. We are quite new to this. We are also learning, but I think
I was committed to making it work. So yeah, I'm glad I'm here too. Nice to meet you.
Nice to meet you. Nice to meet you. Gauri, would you like to just? We have 5 minutes, so I'm just thinking, why should we just be silent? So, Gauri, would you be able to just maybe talk to us, if possible, or I don't know if I'm audible. Dr. Vidhi. Hi. Thank you so much.
Hi. Hello.
Would you just give us a brief introduction?
Yes.
That would be nice.
Yes, definitely. Hi. So I'm Dr. Vidhi. I'm a dentist. I'm currently working in Mumbai. And I have been a professional chess player for more than a decade while I was in school, and I had to leave it for my while I was pursuing my medicine. But now I'm into chess coaching while I'm pursuing my dance, my studies and into the professional dance journey. So, when I saw this webinar pop up, I was very interested because I've been into performing arts also, and also into sports. Right. And now that I also teach as a coach, so I wanted, and plus I am also coming from a medicine background, so I wanted all of that to amalgamate. And this I saw popping up on my feed last night. So I was like, this is a great opportunity to learn. Thank you for getting such topics to the Indian audience.
Yes. We are glad that you appreciate that. And we are so happy that we have Nikki here. It's really inspiring for us too. Thank you so much for introducing yourself. And we will give you a brief introduction of us also, but we're just waiting for 5. But yeah, thank you.
Happy to hear about the dancing, of course. I've got a dancing slide, and a dancing hormone story, if you will.
Yes. So Nikki herself is a trained ballet dancer. So she's multi-talented.
Thank you. That's very kind. I was never a professional, but I've always trained ever since I was, you'll see one of the slides I'm going to show it. It's through my family. My grandmother was a dancer. My mother did dancing. I did do dancing. Well, I did dancing. I started when I was 4, and actually I'm still doing 4 classes a week. So I'm quite proud of myself. But you're right. It is demanding if you've got other things going on, like you said, work and other things. But it's important to make time for what we enjoy doing, whatever that is. For me, it's ballet. But whatever activity it is for you, chess, sport, athletics, whatever it is, that's really important.
True.
Sorry, Aditya, I forgot to add to the dance streak. I'm a Kathak dancer, and I also work at Trinity Lab and Conservatoire of Music and Dance, and I teach there on the dance science course. So bringing the sports science theory to and making it applicable to the dance world. So that's my connection with dance as well. I forgot that bit, sorry.
Really important. And by the way, when I was at medical school, one of the dance shows we did, one of my friends, my medical students, was I can't remember, I have to be honest, I can't remember which style of Indian dancing, I'm sorry, but It's a long time ago. It's a
Yeah,
long
so
time ago
much.
since I was a student.
Yeah, so much, yeah.
But I'll be honest, I can't remember. But all I know is when we were putting the program together, and I said to her, we need to showcase all types of dance.
Yeah.
And the same, it's like sport as well. All types of sport, all
Yeah.
types of dance.
Yeah.
It's got to be inclusive. And there's such a lot of overlap, important overlap between dancers and athletes in sport.
Yeah.
That it's, as you say, very important to have this cross-talk connection.
Okay, so I think we'll just, we are at 5, so let's just get going. And I think more people will keep joining in as we go, but let's be on time. Hello, everyone. It is fantastic to have you all here. First and foremost, I just wanted to wish everyone a very happy World Menstrual Hygiene Day. It's I think it's such an important.
Hello, ma'am.
Hi. Hi. Just everybody do be on mute. I will say the hello highs towards the end to everyone again. But yeah, we'll come back to everyone at the end. So yes, so I think it's a very important day for us women and men, I think, as we kind of navigate through menstruation and everything in and around it. So welcome. And for the day, especially, we have been planning this session with Nicky for quite some time. And I'm so glad that it's finally turned out to be here, and we are all here talking to Nicky. So thank you so much, Nicky, for joining us today. You can go on the next slide. So just quickly a brief about who we are and what we do. So Simply Sport Foundation was founded almost 2.5 years back now. It was founded by founder Ankit Nagori. And the mission of the goal of the organization, as you see, is to help grassroots athletes to succeed in sport and life. It's very important for us to kind of have an holistic approach to it and not just focus on that Olympic medal, but on the individual themselves. So that's that's our very important goal. Our vision, of course, is to impact at least a lakh of athletes through our various programs. I'll quickly talk about our programs as well. And yes, for us, our important values are, being equitable, being sustainable, and being accessible. We want to make sport something that everybody can pursue, and then, of course, chart their path in terms of excellence. Yes, we can go to the next slide. So quickly about our initiatives. So our two important initiatives are community support program, which we also call Simply Roots. The idea with this program is to help grassroots communities which are already there in India, and there are so many of them that want to pursue sport and want to maybe pursue excellence as well, but they don't have maybe the proper support to do that. It might be financial, it might be coach support, it might be a sports science support, whatever that is. We try to help communities across India. We now are working with almost 15 communities, and we are quite sport agnostic. We have been working with various sports across the country, and every state, every place that we go to teaches us something new. So it's been very, very exciting as a new organization to kind of be working with so many communities across India. We want to keep going more and more on that. The second important initiative for us is the Women in Sport initiative. In this, in the last 2.5 years, we have been able to do two things. One has been our Breaking Barriers for Women in Sport report, which is there on the website, and I would encourage all of you to maybe have a look at it, because that's the report that kind of helped us, understand why menstruation and menstrual health is so important in India, especially, and why we need to talk more and more about it. And we call our menstrual program Simply Periods. We have a website as well on it, and you can go and check us out there. As of now, in the last 1.5 years or so, the main thing with Simply Periods that we have been doing is the workshops. We have curated workshops for athletes and coaches that we kind of do, and that has been one of our very important impact piece. So that's something that we do with the women initiatives as of now, and we want to keep seeing what more we can add to that. The other important thing that we do is the athlete support. Our athlete support program comes from our communities. So a lot of these communities have some of the athletes who are exceptional and who we think who we think can actually represent the country and all of that. So our athlete support program actually gives them more support in terms of money, in terms of coaches, whatever that they require. And sports science is something that we do across. It's not one specific program. It's one of the main things that we realized is not available at the grassroots level. And that's why the sports science program is actually across all the initiatives that we do. Nikki, we can go on the next slide. And now Nikki has categorically told me that to not introduce her and to let her do it.
Well, no, it's just because we definitely don't want to read all of that.
Yeah,
it's the main thing. So I will.
Yeah,
so
she wanted to keep it brief, and so I will just Nikki, it's all yours, and I really encourage you. Two things before I give it out to Nikki. One thing is that we will be taking questions, but we will be taking them towards the end, after the first 40 minutes. What I'll encourage everybody to do is to start putting out these questions on the chat, in the chat box. Our team will actually go through all of them, and we will start asking them to Nikki at the end. Why should you ask these questions? Two reasons. One, because you want to learn and you want to get better. But the second, actually very exciting reason for it is that Nikki has very graciously told us that she'll be giving out 2 of her books. She'll talk about her book as well, but 2 of her signed copies, free copies, to 2 people who she thinks ask the best questions. So that's another incentive for you guys. But yes, let's pay attention and really participate. And like I said, the first 40 minutes will not take any of them, but we will start talking to her after that. So thank you, Nikki, for being patient, and it's all yours.
Brilliant. Thanks so much for that lovely introduction, and fantastic. I think you all agree to hear the amazing work that you're doing there. I'm a medical doctor. I will give a very brief summary of that bio because it was very long. I'm a medical doctor, as you've already heard. I'm personally passionate about exercise, sport, but particularly for me, it's dance. It is my my main love. But I like to try and combine these interests of medicine, specifically hormones, specifically female hormones, which is what we're going to discuss today, and the interaction between our hormones and our exercise, whatever that might look like, and our lifestyle in general terms, with a particular focus, of course, on the menstrual cycle, because it really does matter. That's the book that was mentioned, which everything I've learned over the last 30 years, yes, I am old now, of working in the field of hormones, I've tried to impart in that book in hopefully, an understandable way, but also written at a level where if you want to look further, you can look at references and everything. So really, but today we want to focus on a particular group of hormones, a family of hormones. And really, these hormones aptly derive or are associated with Hormone, who is a Greek goddess, right? And that, as you can see, looks very similar to hormones, the word hormone. And Hormone is the goddess of effort, energy, and action. So I think that's a very good starting place to talk about our female hormones. So this is an outline of what I want to talk about today. Really, so you can go away, both for you as an individual woman, but also help hopefully impart this information to those you work with, whether those are athletes, dancers, in whatever capacity, so that we can all feel confident as individuals that we are performing to our best wherever we are in our menstrual cycle and wherever we are in our sort of journey, the female hormone odyssey, as I'm going to describe it. So these are the things I'm going to go through: an overview of the menstrual cycle, how to take advantage of the menstrual cycle. I do feel that quite a lot of the talk about menstrual cycle, when you hear that word, often it has a negative connotation, but I want to propose that we should look on this as in a positive way. And also to accept that there are challenges, nevertheless, associated with the cycle, and certainly we'll discuss that. And then, of course, the exciting talking about taking questions and discussion, and of course the book giveaways at the end. So where do we start? So there are certainly challenges along the way of when we talk about menstrual cycles, but I would say actually challenges, some of them are from the outside. It's fantastic to see more and more women participating in sport, and also more women participating in sport and reaching really high levels. And sports, it's great to see that advancing, but also in the world of dance. And this is an example. This is just within my own family, by the way. You can see that on the left, that is actually my grandmother when she was in her early 20s, during the 1920s. And you can see that she is on point, but she's wearing a loose-fitting costume, and both feet are firmly on the ground. And then you can see me at about the same age in the 1980s on the right. And I think you'll agree that, you know, even within our family, there's a more athletic demand. If you could put your things on mute, that would be really helpful, thanks. And we'll take questions at the end. So that is an example of the increased challenges as well. So talking about hormones specifically, the word hormone actually derives from an ancient Greek word meaning setting in motion. And that just perfectly describes what hormones do. They set in motion, they bring to life our DNA. DNA, as you know, is the blueprint for life. And hormones, what they do is they direct the DNA, direct the gene expression on which proteins to produce, which ones to produce, and how many, how much, at what time. So the hormones are really, really crucial for unlocking unlocking our potential in terms of health and performance. So that is why, by the way, I'm absolutely passionate about hormones and think they're fascinating. I think when we say the word hormone, you probably may have heard, oh, it's a chemical messenger transmitted in the bloodstream, but that sounds very boring, doesn't it? And it doesn't explain how crucial they are to directing our health, both mental and physical health, I want to emphasize. And being transported in the blood, they have access to every single cell in the body, so pretty amazing. And in terms of the effects of exercise and hormones, what's the connection there? We all know that if you train and you exercise, then this will hopefully lead to improved performance and adaptations. Adaptations both.
Sorry for that. Nikki, if you could just hold on for 1 second, I'm sorry. I'll just mute everyone again, and then you can unmute. Yeah, Nikki, if you could please unmute. Nikki, are you able to?
Yes, I can. I'm unmuted now.
Okay.
That's okay. Yes, great.
Thanks. I'm sorry, I might have to do this a few times.
No, don't worry. And also just another thing, I don't know why this red squiggle's turned up on the screen if we're on technical things.
Oh, yes. Yeah, I will just I'll
get rid of the red squiggle. Thanks. That's not part of the slide. Right. So
Nikki, apologies. I'll just switch the what we as we had discussed. I'll just change the setting.
Okay.
If you could stop sharing.
Yep, sure. Can I reload the slides?
Just 1 second. Yes.
Yes. Okay. Okay. So, oh, good. No red squiggle. Right. So hormones are really crucial to health, but also to our performance. Hormones drive the positive adaptations to exercise that we perform, particularly when we're asleep, actually. Positive adaptations, both in the physical sense and, as you can see, neurological and mental sense. Now, the good news is that we can harness our hormones and get the most from these amazing chemicals in our body through our behaviors and our decisions around our behaviors for the athlete, for the exerciser, in terms of exercise, the training load, the nutrition, and the recovery. Those are the three key ingredients. And if we can get the right amount of those at the right time, the combination of these three things, then that will indeed harness the hormones and will drive those positive adaptations that I've just outlined on the previous slide. And of course, that will lead to us attaining our optimal health and performance. So that's the theory, but we do have a slight challenge when we're considering the female hormones. Because out of all the hormone systems in the body, there are many. I think you will agree, if you look at this slide, that these hormones, the female hormones, the hormones of the menstrual cycle, are the most complex, the most beautiful. This is really intricate choreography I'm showing you in this slide. And this happens every single menstrual cycle, this fluctuation of these hormones. So number one, that's quite complicated. But the other important point to bear in mind is that every woman is different. Every woman will be slightly, subtly different in terms of the levels of these hormones I'm showing you on this graph. Also in the timing of these hormones, they won't always happen in an absolutely standardized way. There will be subtleties in the difference in the timing. And crucially, and probably the most important, each woman will have her own individual biological response to these hormones. So even if you have two women who have exactly the same timing and level of a particular hormone, let's say progesterone in the luteal phase, they might feel totally different. One might feel great and the other might not feel so great. So that's why it's very important that a personalized approach, especially when it comes to the menstrual cycle and female hormones, that's really important to bear in mind and be wary of the generalizations. But having said that, there are some outlines about the menstrual cycle, which I think it's really important just to present here and show. So periods start at what's called the age of menarche. So when your periods first start, the average age is 12, but there can be some variation either side of this, but certainly including exercises, whatever your level of exercise, your periods should have started by your 16th birthday. Some say 15, but I'm going to say, okay, I'll leave it right up to the end of your 15 years and say on the chime of your 16th birthday, if your periods have not started, now we give that a name. We say this is primary amenorrhea. Amenorrhea means lack of periods. And so the first thing to do, if I see anyone presenting like this, they're 16 or more and their periods haven't started, then actually this necessitates medical investigation. Make sure there's not a medical reason. Let's hope that once the periods have started, the individual has reached menarche, then from then onwards, menstrual cycles should occur reasonably regular. But the cycle length, so that's the time between the start of one period and the beginning of the next, it's not like the textbook says 28 days. It's actually 29 days is the average. But anyway, it can be anything from 22 to 35 days. That is fine, normal, and healthy. Again, I get a lot of athletes and dancers coming and saying, oh, I'm really worried my cycle length is 24 days, or it's, it's 34 days. Oh, gosh, is that something wrong? It's like, no, that's fine. So long as it's within that range, that's okay. And there can be slight changes from cycle to cycle. Some people are I used to be exactly bang on 26 days, but it's very individual, like we've said. So although the cycle length can vary between individuals and even from cycle to cycle, if you do your maths over the entirety of a calendar year, women should have at least 9 periods. And if you do the maths, that means that the cycle length should never regularly be longer than 35 days. And again, if there are fewer periods than this per year, then we give this a term, we call it oligomenorrhea, few periods. And again, that should indicates that medical investigation is required just to rule out anything that might be causing that. And certainly if the periods stop consecutively, for some sources say 3 months or 6 months are an absolute push. If the periods stop for that length of time and the individual's not pregnant, then again, this indicates medical investigation, because this is called secondary amenorrhea. And then the periods the menstrual cycles will continue up until the age of menopause, when periods stop. We'll talk about this a little bit more later. Average age for menopause is 51. So you can see that for every woman, you know, if assuming her periods, say, start at the age of 12 and they stop when she's 51, that's a long, big chunk of her life. So definitely we need to be talking about this. And by the way, this has been happening for millions and millions of years. So it's not something that we should shy away from and avoid talking about it, because it's natural physiology, as I said here, natural and healthy physiology. And just to emphasize here, having a period is a barometer of internal healthy hormones. So this is a free monthly medical check. If you're having a period, at least 9 per year, like we've said, then actually that's a pretty good starting point that you can be, you know, reasonably confident that your internal hormones are doing their thing. And we should embrace this and talk about this. And certainly this is applicable whatever level of exercise you're doing, regardless of how much you're doing. You know, international athletes down to the just sort of the amateur exerciser, these menstrual cycles should be this and the period should be this barometer, used as this barometer of health. So again, I see a lot of dancers and athletes come and say, well, I was told it was okay or normal for my periods to stop because I'm an athlete, a dancer, whatever. I'm here to tell you that's not correct. It needs looking into if periods stop or become very irregular. And actually, we should, like I said, embrace this and look on this in a positive way. Number one, it's a free monthly medical check, but also it can be useful as a training metric. And so if you're recording your cycles, as we'll talk about a little bit more, then that actually be a really good indicator that the athlete or dancer has got a good balance of those key behaviors I mentioned of exercise, nutrition, and recovery. Why am I making such a big deal about this? Why are menstrual cycles such an important indicator of health? There are many areas where female hormones are important for health and performance, but these are, I'm just highlighting 3 of them here. We know from studies that in athletes or young women whose periods have stopped and they're not pregnant, i.e. they've got amenorrhea, we know that they're at a much higher risk of injury, both bone injury and soft tissue injury, because these female hormones, in particular, estrogen, which is what that molecule is up there, by the way, produced by the ovaries, that's very important for bone health and also soft tissue health. Also, these hormones released by the ovaries are very important for cardiovascular health. We know this from menopausal women whose periods have stopped, like I mentioned, and have low levels of estrogen and progesterone. They actually have an increased risk of developing cardiovascular disease. The other area is these hormones are very important for neurological function in terms of mood, and also very interesting study from colleagues in Denmark showing that in athletes whose periods have stopped, not only are they at risk of bone stress injuries, but also they have issues in terms of neurological function. They have a slower reaction time and lower peak power production. So again, let's talk positively about menstrual cycles and the hormones therein. So how to take advantage, tap in to these amazing female hormones of the menstrual cycle. So broadly, I'm going to keep this sort of straightforward because I know there are all sorts of fancy apps and things out there which claim they can subdivide the cycle into sub phases and all sorts of things. But actually, practically, if you haven't got access to all of this stuff, what are you going to measure? You're going to definitely know when you're having your period, menstruation, the start of the cycle. And you're going to know already when your next cycle starts. So already you've got the menstrual cycle length, which is actually pretty important. And also ovulation. Again, there are lots of fancy things you can do, but actually one very straightforward way of knowing roughly when ovulation occurs is the change in cervical mucus. And this is not expensive test. And actually there's a big WHO study which lots of the participants actually were women from India, interestingly, and who were taught to understand the changes in cervical mucus. So, well, those are the key things you know. When does your cycle start? When does the start of the next one? Already you've now got the length of the menstrual cycle, and if you look at cervical mucus, you've got a rough idea of where ovulation is as the marker. And now you can divide that easily enough into the follicular phase and the luteal phase. The follicular phase, as you can see from my diagram there, the choreography of the hormones, you can see estradiol, by the way, is the most active form of estrogen. You can see that that's the dominant hormone in the follicular phase, especially ramping up just to trigger ovulation there. And then in the luteal phase, you can see the dominant hormone there is progesterone. So bearing that in mind, let's look in a little bit more detail about those phases of the cycle. So the follicular phase, so that's estrogen is ruling the roost. And especially in that late follicular phase, as the egg is being keyed up to be ovulated, there is theoretically an advantage of having these high estradiol levels in terms of favoring intensity and strength work. Theoretically, I use that word again because although theoretically that would sort of make sense, there are some women who actually find this is the worst time of their cycle. And I quote a professional female cyclist from England, and she describes how she found this phase of her cycle actually for her the most troublesome, because she found that actually exercising, it just felt really, really hard, subjectively just felt really difficult. And she was really concerned. She thought there was something wrong with her because she'd read various apps and her colleagues and friends were saying, oh yeah, we feel brilliant during this phase of the cycle. So just to highlight, whatever you feel, that's okay for you, but just the point is to get to know your own body. So that's really the crucial thing. What about the luteal phase of the cycle? This, as you can see, is when progesterone is the ruling the roost. And progesterone is a fascinating hormone because it increases metabolic rate. So it speeds up the rate at which we use energy effectively. And this has several effects. Number one, it increases our body temperature. And this is the theory behind the ovulation thermometer. If you measure your temperature during the cycle, there'll be slight increase in your body temperature, not much, like 0.2 of a degree Celsius during the luteal phase. But this can literally how does that make you feel? It literally makes you feel hot and bothered. Okay, you're feeling hot, and this can disturb sleep. Also, the effect of this hormone progesterone is that there will be an increased energy demand. So if you're not consistent with your intake, particularly of carbohydrate, then you might feel these hunger urges to eat something because you feel really, really ravenous. But it's much better to be prepared for this and make sure you have a consistent intake of carbohydrates to avoid these hunger urges. And also protein is particularly important during this phase of the cycle because this hormone tends to be catabolic, tissue breaking down. And again, sleep, the chief nourisher in life's great feast. That's a quote from Shakespeare, not me. But it's a very apt quote because sleep is when many of your hormones work their magic in terms of adaptations. And if your sleep is disturbed, as we all know, that doesn't feel good. Hence Sleeping Beauty there, by the way. You don't have to sleep for 100 years, but certainly trying to get a good night's sleep. And if you are in this phase of the cycle, making sure you're sleeping in a well-ventilated room, simple measures just to control that body temperature is really helpful and important. So I personally encourage athletes and dancers I work with to track their menstrual cycles. It doesn't have to be a fancy app. I'm very old, so actually there weren't apps in my day. So a pen and paper is absolutely fine. But the thing is to record it. So you can get a feel for how your cycle is for you. And then also this means that when you come to competition day, this is obviously a football team, but the same thing for a dancer. She cannot dictate when the opening night of Swan Lake will be. She can't change that. And so, but if she knows in advance, she's worked it out from her own personal recording of her menstrual cycle, she can anticipate most likely she's going to be in the luteal phase, for example, on that opening night. And she knows that she doesn't feel great in the luteal phase because she does feel hot and bothered, her sleep is disturbed. then before that, in the months before that performance, I can work with her and we can work out what are the best strategies for her. So in this case of this football team, every player in this team walking onto the pitch that day for their competition, their match, they will feel confident not only in their tactics, their equipment, all that sort of thing, but they feel confident in themselves, in where they are in the menstrual cycle, that they put into practice already and tried out the strategies that work for them. So that's really how to take advantage of your menstrual cycle. Monitor and get to know your own cycle and what works for you. Try it out before competition day is my top tip. There are some challenges with the menstrual cycle. Of course, I've said how fantastic these hormones are, but there definitely are some flashpoints in the menstrual cycle that I come across working with athletes. So there's the menstruation itself. So this is when you're bleeding, obviously you're losing blood, can be associated with cramps. Some simple action is to make sure you keep well hydrated, keep on top of your iron intake because you'll be losing blood. And studies show that actually doing exercise, gentle exercise, can actually help, because we all know if you're in pain, you just want to curl up in a ball, you don't want to do anything. But actually doing something, especially that elongates those muscles, really helps. So Pilates, yoga, something like this will help, and that's been shown in studies. If I put the word endometriosis up there, because if you know, athletes and dancers I work with, I give this sort of simple advice and we monitor and see how things go. But if the pain and the difficulties are such that even these simple measures and simple anti-inflammatories don't help, and it really affects the quality of their life every single cycle, then there could be a possibility of endometriosis. So this is where the uterine tissue is kind of misplaced in other bits of the pelvis, like the gut and the bladder even. So that's just sort of a warning sign if, or despite all these simple measures, there's still problems that might need looking into medically. There's a lot of talk recently about ACL injuries, anterior cruciate ligament rupture. And certainly here in the UK, we've had lots of top level female football players suffering this type of injury. There have been some studies which suggest that this is more likely to happen just before ovulation. Remember, when the estradiol is going up very steeply, because it affects the laxity of collagen and the ligaments. However, there are other studies which don't show this finding. So the honest answer is we don't absolutely understand why, but we do know that part of it could be extrinsic factors. Women obviously have wider hips, and so there's a different loading angle on the knee, and certainly sports where you're rapidly changing direction. And a lot of these sports, unfortunately, still are based on the sort of the male model. They use the same type of football boots, for example, the same pitch, etc. So there could be external reasons, and no doubt there are some internal reasons in terms of hormones, but like I've already stressed, each woman is individual in the timing and the levels of her hormones. So there definitely must be some sort of hormone connection, but we can't make a generalization because it's for the individual. But what we do know is that doing proprioceptive work, so awareness of where your body is in space and all the stability muscles around the knee, that's definitely going to be helpful for every single woman. The luteal phase I've already mentioned can be a problematic time in the cycle because of the increase in body temperature and the increased metabolic rate. I've already mentioned some of the sort of simple, straightforward strategies in terms of keeping cool, consistent fueling. You might need more recovery. Also, we know actually, interestingly, the vitamin D can help. So if you're not taking vitamin D, or athletes you're working with and dancers are not taking vitamin D, definitely that's an important one. If these symptoms, despite these simple, straightforward strategies, aren't working, we would call this premenstrual syndrome. And again, that's these symptoms happening on a regular cyclical fashion, coincided with the luteal phase. And actually the most effective, the next sort of level of how you would go about helping that athlete is actually chasteberry. Agnus castus has been shown to be effective. So that would be my next step up from managing an athlete suffering with premenstrual issues. So a menstrual cycle story. So a female Indian dancer. I'm not sure exactly what style that is. It's kind of a little bit made up. Anyway, she was 28 years of age, and she was having very heavy periods and really suffering with fatigue. She was also vegetarian. So that's a clue. So this is one of the flashpoints I mentioned, losing a lot of blood, losing a lot of iron, and she's already vegetarian. So potentially her iron intake is not sufficient. So in this case, this would be straightforward. Let's look at the nutrition, let's look at the diet, let's see how we can boost the iron intake and make sure she's well hydrated. And that will certainly help with fatigue. It might also be necessary, if it's possible, to measure the iron. That would be fantastic from a blood test measuring ferritin. But if those simple measures don't help, then iron supplementation, ideally combined with vitamin C, makes for better absorption. So that would be a straightforward approach for this particular dancer. What about an athlete? These are all obviously fictitious, by the way. I'm just giving them names so that it's a little bit more relatable. Athlete, 20 years of age, and in the 2 weeks before every period, she was not feeling great. Poor recovery, sleep problems, low mood, not feeling good. So the 2 weeks before the period, that's the luteal phase. So this is definitely an athlete with premenstrual issues. So we would go through all the simple, straightforward things if she's not doing those already. Consistent intake of carbohydrates spread out through the day, keeping cool, sleeping in well-ventilated room for sleep, maybe slightly modify the training, speak with a coach, very important. I always bring in the coach or the teachers to discuss anything I might suggest with regard to training, because it's got to be a conversation. And if these simple things don't help, and she's taking vitamin D, by the way, then actually this would be the sort of athlete that might benefit from taking chasteberry. Certainly worth trying and seeing if that helps. Just one slide about hormonal contraception. I think it's important just to mention this thing was talking about menstrual cycles. So the first thing to say is that, of course, it's every woman's individual choice if she wants to use contraception and what type of contraception. I'm not talking here about barrier methods of contraception, which don't have any effect on hormones. So in other words, condoms and the copper coil. But what about the hormonal types of contraception? We can broadly divide these into two types. There's the progesterone only, and there's the combined oral contraceptive pill. The progesterone only typically don't give you any sort of bleeding. So examples, the mini pill, there's an implant, the Mirena coil, there's also a depot injection. And actually, if you're an athlete, and for example, I'm thinking of Swan Lake where you have to wear white tutus, if actually you would quite like not to have any sort of bleeding, then, and you've got regular cycles already, then actually the progesterone only might be a good choice. But it's definitely not a good choice for the previous athlete we saw. If you're already suffering with premenstrual issues, when progesterone is high, definitely this is not going to be the good choice for you. The combined contraceptive pill, as the name suggests, is a combination of synthetic estrogen and progesterone. And typically, depending on how you take it, you will get a withdrawal bleed. Please notice this is not menstruation. This is a bleed caused by those synthetic hormones that you're taking. Now, the combined contraceptive pill is an example of a hormonal contraception that suppresses ovulation. Some of the progesterone only also do this. Now, this could be actually very helpful in some medical conditions. I mentioned endometriosis, severe pain. So actually, in that case, suppressing female hormones could be quite helpful. And also in the management of PCOS, polycystic ovary syndrome, the combined contraceptive pill lowers testosterone levels. However, to emphasize, we should never give or advise taking the combined contraceptive pill if a woman presents with primary or secondary amenorrhea. So she says, I haven't got any periods, then definitely the pill is not indicated. This is from Endocrine Society guidelines, and also here in the UK, I wrote to NICE, National Institute of Clinical Excellence, and they changed their guidelines. So why am I saying this? What's the evidence for this, that we shouldn't give the pill? I suggest that giving the contraceptive pill in this situation of a woman with no cycles no periods, makes everyone feel better. It makes the doctor feel like they've given a prescription. The recipient is having withdrawal bleed. She might think, oh, well, something's happening with my hormones, might mistake this for menstruation, but actually this is what your hormones look like when you're on the contraceptive pill. Any hormonal contraception that suppresses ovulation, it suppresses all the hormones like this. Where's my beautiful choreography gone? You can see it's in the background. So suppressing the hormones like this might be very useful, like I said, if you're really suffering with endometriosis. But obviously, this is not a good situation if your hormones are already in this situation, which they will be if you have functional hypothalamic amenorrhea. I'll come back to the exact term, explanation of that. But suffice to say, one has to be quite wary of who you're advising to take the basically it's making sure the athlete and dancer makes a really informed decision in terms of contraception. That's really the fundamental point. So, other challenges of the menstrual cycle. You've seen a version of this slide already. Just to remind you that we can harness our hormones, including our female hormones, if we have the good balance of training, load, nutrition, and recovery. You can see this is going to make for a very healthy and good performing athlete or dancer. So that's great. But what happens if these athlete behaviors get out of balance, out of sync? And this is the situation of low energy availability that I'm moving on to now. So in this slide, you will see that the athlete in the center looks very happy, quite rightly, because they are taking on board sufficient energy to cover their energy demand from training, shown in blue, and the residual energy known as energy availability. Big amount of energy required just to stay alive. Just as even if we lie in bed all day, we need a lot of energy to just stay alive, keep the menstrual cycles regular, maintain our body temperature, etc. If you're an athlete that has a very high training load, but you've not factored in that you need extra energy, then you will end up in the red, in low energy availability. So this is an example of unintentional low energy availability. The athlete or dancer just didn't register that they should have increased their nutritional intake. This is a concerning athlete, a dancer or athlete who has intentionally restricted what they're eating, because they believe that this will confer a performance advantage, either in terms of being lightweight, if you're competing or taking part in sports against gravity, which is living on Earth, that's most of the sports, like climbing, like road cycling, all these sorts of sports. Also aesthetic sports, which require a certain look and whatever. This is rhythmic gymnastics. And of course, dancers, although it's not sport, definitely there is an aesthetic requirement there as well. So this would be an example of intentional low energy availability. So what are the consequences of a low energy availability? Does this matter? You know what I'm going to say next. Of course it matters, because if you have low energy availability, then the body will respond. It will adapt and it will try and save energy. And it will do this one way is by reducing hormones, and particularly for women, actually saving energy by not having menstrual cycles, because I've already said there's an increased metabolic demand when you ovulate. So if you just cut out menstruating at all, then actually that's going to save energy. So if you're in low energy availability, then you can end up with adverse effects on both your health and, crucially, performance. This is known as REDS, relative energy deficiency in sport. Don't let the name distract you from the fact that it's not isolated to sport, or certainly not elite sports people. Amateurs and, of course, dancers can be impacted by this. This is an extension, by the way, of the female athlete triad, okay? So the female athlete triad, as the name suggests, just was dealing with female athletes and described the adverse consequences in terms of lack of menstrual cycles and poor bone health. But you can see there's a whole raft of adverse health effects and, crucially, performance effects. And this is the graph I show to my athletes and dancers. They might say to me, look, I'm not sure you're right. I don't have any periods, but actually that doesn't bother me. And I'm doing quite well. I'm performing, I'm competing to a reasonable level. I'm not sure this is a problem. And I show them this graph. And basically I say that you are underperforming. Imagine where you could be, rather than being here, a REDS athlete in low energy availability, could be a really healthy athlete. Yes, we've got a little bit of noise. If someone could mute themselves.
One
Nikki,
second.
you can just go to the chat and mute everyone. Go to the participants, click on participants and mute all.
Rajiv,
Okay.
it's you're on, you've unmuted yourself.
Mute all. Mute all. Right, now I have to, hold on.
It's done.
Oh, it's done. Right, you can still hear me, that's all right. Phew. Right, okay. So we were going here, the adverse effects on performance of REDS, which actually is really important to stress, because this is how you can get athletes and dancers to cooperate, as it were. And what I look out for is, of course, the dancer or athlete reporting disordered eating, not necessarily a full-blown eating disorder, but especially avoiding carbohydrates, for example. Exercise dependence, so really trying to train when it's obviously not sensible to do so because they're ill or injured. And these are, especially for the young athlete, can be concerning if it's stunting their growth and development, and of course if they're suffering with primary amenorrhea. For the women who have already started their periods, of course, developing secondary amenorrhea is a big red flag that something's not quite right. And also they're more predisposed to illness and injury and gastrointestinal problems. And also their behavior, their mood, their sleep's going to be disturbed. They just will not be feeling great. And this is a website that I wrote for the British Association of Sports and Exercise Medicine, where there's further information about REDS, and maybe you want to include this website with simply Sport Foundation, because this is written for, as you can see, athletes, coaches, parents, and all healthcare professionals, to give more details about REDS. And so here we have our menstrual cycle story. Tennis player, notice her age, she's 18. And she increases her training load, because often as you move from junior to senior ranks, obviously you're going to increase your training load. And also we have to accept, well, not accept, but we have to point out and recognize that women in particular, I would argue, are, with social media, there is a pressure sometimes about body shape and weight. And also for professional athletes, you know, this can also, even in sport you might not expect that could be, where athletes could be at risk of REDS. For example, tennis, it's not an aesthetic sport as such. Nevertheless, sometimes women are still not getting paid as much as male professional sports people, so they have to look for endorsements to boost their income. And unfortunately, endorsements sometimes come with picking the athlete that looks a certain way. So this particular athlete felt the pressure, as it were, and reduced her energy intake. Periods became irregular, then stopped, and she suffered with a stress fracture of the sacrum, because this, as I've mentioned already, these female hormones, menstrual cycle hormones, are very important for bone health. And often, and it's really sad, it breaks my heart every time I see a female athlete coming in with some sort of bone stress injury. It can occur anywhere in the body, but in particular, the lumbar spine and the sacrum, those are the bones, trabecular type bones, that are particularly adversely affected by lack of periods amenorrhea. So in this situation, it will be a case I would discuss with the athlete, actually, you know, about explain exactly what I've explained to you, that she needs to, or we need to talk about her training load and her nutrition to get the right balance there to reboot her hormones. So the last bit of my talk is just going to go through, I've focused mainly on women of reproductive age, but I just want to point out there is a female hormone odyssey, a journey going on here. So all women will start down here as a child with low levels of hormones. Hopefully then you will progress to have these menstrual cycles with this beautiful choreography of the female hormones. You might take a little diversion up here to pregnancy. Hopefully you won't revert back down here if you develop REDS. And then ultimately, you know, you will reach the menopause, and that's sort of kind of like this one, you're going back to low levels of the ovarian hormones. So just to sort of put this in context, what we're talking about, the menstrual cycles. So the ages of an athlete. So in childhood, of course, as a child, you will not have the adult levels of hormones, and in particular in women, your periods have not yet started. So actually, we should not try and encourage children to train like adults, because it's not going to end well. Their body just simply is not able to cope with that. The teenage athlete, again, the hormones are just awakening, certainly in terms of the menstrual cycles, the female hormones. And this is a crucial time for accruing peak bone mass. So again, sort of kind of caution again with the training that these athletes are not overtraining. The young adults are the ones we focus on pretty much just now, the menstrual cycle and the challenges associated. What about as you get older, like me? Well, unfortunately, it's not great news, but what happens is, you can see, as you get older, your hormones decline. Growth hormone, interestingly, declines for men and women. Men, there is a slight decrease in testosterone, slight, but I'm afraid women, yes, our estradiol really takes a plunge, and this is associated, of course, with the menopause. However, I want to keep this on a positive note. I know this is talk about menstrual cycles, but unfortunately, I don't have a daughter, so I've got to resort to my son. And I show this slide as an example. That's my youngest son in the foreground, and that's my husband, 30 years older, behind him. So after 2 hours of racing, and although there's 30 years difference, there's only 3 seconds difference. So well done to my husband, is what I want to say. And if you're a masters athlete, you can continue to compete with your children, by the way. But you need to take a particular attention to your training. You can't train like a 21-year-old anymore. You need to really make sure you're doing strength training, in particular for musculoskeletal health. Also nutrition, we need more protein to maintain our muscle mass. And don't forget vitamin D. That's really helpful at all ages, but in particular as we get older. So I would argue that this is a positive thing. We have to embrace this, because this is what will happen to every woman at some point in her life. Her hormones will change to show those of the menopause that I've shown there. And it's really important we consider this population of menopausal women, because with increasing life expectancy, we might be spending up to a third of our life in menopause. So definitely we want to make sure these are, good quality years, and we're continuing to do what we want to do. So definitely we should address the lifestyle factors of our training load, of our nutrition and our sleep. But just a quick word on HRT, that certainly this has got benefits in terms of quality of life for sure. And also for our long-term health in terms of bone health. And also certainly athletes and dancers I work with. But if you're feeling better, you're obviously going to train better and feel better about your exercise. To put it in context, although there is a slight increase in breast cancer, it's true, this is no more than taking an oral contraceptive pill. So that puts it in perspective. And if you're doing exercise, then actually this reduces your risk of breast cancer. So if you do the calculations, it's obviously something worth considering. So just to wrap up, I want to remind you that we all need to embrace our inner goddess of effort, energy, and action, i.e. our female hormones. And we want to talk positively about the menstrual cycle and the benefits we gain from it. Be aware of the challenges along the way, of course, but know that there are strategies to deal with these. And crucially, also, I started saying that every woman is slightly different and individual. And this is a beautiful quote: treat women as individuals, not statistics. Unfortunately, that's not my quote, but I like to use it and mention it because I think that's really, really important. I've given you some outlines and some guidelines and things that I've noticed, but then hopefully you can translate this either to yourself or to those that you're working with. And then we're going to mention and that's the mention of my book, where we've got more details, and hopefully 2 lucky people will be receiving their copy. So I'm going to pass over, stop sharing. I think it's easiest, isn't it? And maybe you want to take over, Aditi, and share the questions.
Sure. Nikki, that was fantastic. Thank you so much. I think you covered so many things, and it's a thing to learn to kind of, how you do that. So thank you so much for that. That was very, very interesting. So we have a range of questions, luckily, so it's going to be difficult for you to choose. But we are going to try and see, so I think we are kind of ranging from symptoms to hormonal pills, to some maybe practical problems that one can face, especially for a country like India. I mean, we are looking at different kinds of travel related questions as well, like diet, travel, menstruation. How does one work with that? So I'm going to just quickly ask Tanaz, if Tanaz, is there a way we can maybe look at these questions? Should we take them one by one? What do you think?
I think there are a few specific questions, but there are a few that we can club.
Okay.
So essentially, I think some of the things are that how do you like they said, how do you manage periods, especially as an athlete in every aspect, which is like travel, diet, and if you have I think one of the first questions was that if you have any other disorders like ADHD, how do hormonal imbalances affect these things? So how do you, if you have any issues like PCOS or any other ailments, how does the hormonal imbalance affect these things, is one set of questions that has come up.
Yeah, hold on.
I start with that one, and then I can give you the next.
Sure. So I think the first one, thank you very much for, by the way, everyone, for the questions. So I think the thing about, the theory of it, how you put this into practice was one of the things. Because if you have, and I think actually this was from a coach saying, the individualistic approach, difficult, I agree. If you've got 40 players, and you've got travel and you've got lots of other things going on, and other variables, that's a good example. So I can relate to that because I'm the advisor to Scottish Ballet, for example, and so I've got a lot of dancers, and they do travel, they go on tour, and they're all going to be doing the same company class and things like that. So in practical terms, I think it is, how I approach this is that I do, as I mentioned, have a tracking system, which I set up myself, that the dancers can communicate with me, as it were, or indicate where they are in their cycle or what's happening and how they're feeling. That's really important, so that I can spot, number one, if there are any medical situations, or like I've said, if you get to know the athlete, the dancer, how they are during their cycle, then it's easier to give them more particular recommendations. That's me speaking as a doctor, by the way. Then I agree, how do you transmit that to coach? And I'm very fortunate in that I've got a very good communication with the head physiotherapist who manages sort of the medical side, and also the artistic director of the company is very proactive in supporting the health of his dancers. So for the coach, that is difficult. You have to take on board the information that your players are presenting you with. And if there's a particular player or dancer that always says, right, I always feel bad during this type of my cycle. And if there's a possibility as a coach, you're taking note of that. And if some bits of the training you can't change because they're all training together, but if there are extra bits like the strength and conditioning, you could modify that specifically for the player. When we now throw into travel as well, because travel and changing time zones especially can interfere with the timing of the menstrual cycles. So again, I think it is that getting that information about the individual athletes and dancers. Some of them will be badly affected by the travel, others won't be so much. So the simple answer is just collecting that information and making it possible that the athletes don't feel embarrassed or awkward discussing this with, you know, if you have a healthcare professional, someone like me, or the coach, so that the coach is on board, or the coach makes it known to the athletes and players, yes, I understand. If you come and tell me I suffer with really bad menstrual pain and I can't do such intense training, then as a coach, you're going to say, yeah, I understand what that is and I accept that. I'm making a note of that. So I can't see a quick way around of that. But that's the general gist for that. So I hope that helps. Shall I move on to the next batch? So the next,
Yes.
Was there any comment on that one?
I think there's some very specific questions in the last. So if you see, Anvi has asked a very specific question, if you would like to take that, because there is a similar question that has come up earlier as well.
Is that the menstrual cramps one?
Yes.
Okay, so the question is, menstrual cramps during the luteal and menstrual phase are limiting factors. Okay. Prostaglandins, yeah. Well, for any cramp type pain, and prostaglandins, yes, are, but actually the best one is just an anti-inflammatory, ibuprofen or something like that, because those anti-inflammatories do indeed act on the inflammatory pathway. So yes, knowing that this might happen, trying to do what exercise you can, but actually proactively taking anti-inflammatories can be helpful. So rather than waiting until the pain, you get really bad cramp, of course, you don't want to be taking anti-inflammatories like all the time, but to a certain extent, preempting that and knowing that that's what's going to happen, that can be helpful to nip it in the bud. So, but it's anti-inflammatories are the main thing. But if it gets so bad, even despite anti-inflammatories, then, as I said, then that raises the question in my mind about endometriosis, maybe. I think there is quite a lot of questions about hormonal contraception type of things. So maybe that.
Also, just if you could add a little bit about how hydration affects pain, period pain, essentially. A few people have asked that as well.
To be honest, the hydration, it's not like, oh, you hydrate and then that's a direct effect on pain, but it's just in general terms, you'll be losing fluid. So that's why it's really important to keep well hydrated, quite well hydrated all the time, but particularly during that time, because you'll be losing fluid. That's the main thing. Can I go on to the hormonal questions? So there's a question about progesterone only, which typically stop any sort of bleeding. And it says, and the question is that some athletes are advised to take this before a tournament. Right. Well, I mean, personally, I wouldn't particularly recommend that, doing it. I mean, I know that happens. But well, yes, I kind of agree with the question. It's like, why, if we're trying to be positive about the menstrual cycle and menstruation, why are we advising? Well, I certainly hope it's not the coaches advising them to take hormonal pills, by the way. But anyway, so, you know, I think that where at all possible, the best thing is let your hormones do their things. And as I said, get to know them, get to understand them, put in personal strategies. As I said, take advantage of these menstrual cycle hormones. That is my view on this. And I know that this can happen, that the progesterone only is taken to delay bleeding. But the thing is, I mean, personally, I wouldn't recommend that, because anything that's interfering with your own hormones, and especially if you're just doing it, oh, just do it, and you haven't you don't know what the effects might be, by the way, and actually this makes you feel really, really dreadful, then that's definitely not going to help you compete. But actually being confident about knowing what to do during menstruation. I mean, in practical terms, what sanitary wear have you got available? And if you do experience any issues, any cramps, have you practiced dealing with those? So I'm not in favor of that. And also, I think there was another question about something else about contraception, which I can't find. Here we are. This was someone having pills given happy. Well, yes, exactly. This is a similar question. There's a question by Dr. Singh saying that giving hormonal pills, contraception pills, or whatever thing, like to try and sort of artificially manage the cycle. I agree with you. It kind of messes up your own, it leaves your own internal hormones all at sea. So I'm not against hormonal contraception, just to make it clear. If you're taking it for the if you're taking it for a medical reason, or you're taking it like consistently for contraception, I'm not going to tell any woman not to do that, of course. But what I am concerned about is trying to use hormonal contraception as a way of manipulating cycles. And especially I'm concerned when this starts at a young age. There are studies that show that starting a teenage girl on hormonal contraception can have really adverse effects on her health. There's a yellow card warning out in the US on the depot injection of progesterone in teenagers because it interferes with bone health. And also there's a recent study showing that there's the same effect of the combined contraceptive pill on the attainment of peak bone mass, because bones are very dependent on estrogen. So if you suppress estrogen, guess what? It makes no surprise that it might adversely affect your bone health. Okay, so as I say, if there's an important medical reason, of course, I'm not going to say don't take it. But to give the hormonal contraception as a way of some perceived convenience, I don't know, or switching off a period or some other reason, and especially nuanced with the age of the athlete, I am concerned. And it's also, I'm concerned, it's got to be an informed decision. That does the young athlete actually realize because still there are women, when I showed them that slide I showed you, this is what your hormones look like on the contraceptive pill, I still get people flabbergasted. It's like, what? We didn't realize that. We would have never taken it had we known. So that's the thing. I'm not trying to make people take decisions. I'm trying to give the information and so they can make an informed decision. That's really the crucial thing. And going back to the thing where women's with amenorrhea who are put on the pill, it still happens, despite all the evidence there and all the guidelines. So you heard it here. Please go out.
So Nicky, just to let you know that we have crossed the 6 p.m. mark. And
sorry, I tend to get very carried away.
We would love you to be around more and all of that, but I just wanted to let you know that we are off the 6 p.m. mark. I think what we could do is we could take one last question from the chat, maybe, and then you can pick up the winners. Is that okay with you?
Sure. Well, I mean, I'm just looking at this question here. I've just literally looked at it. So is there a difference in the approach of training in adults and those who are in their puberty? Exactly. Although that is, we've kind of sort of done that, I guess. Can you help me?
Yeah, sure.
Is the one that you think that we haven't?
I think there are two quick questions that we can maybe take and end this. One was about by Seema. She's asking how about a postnatal woman who hasn't yet started their period after 18 months, is no longer breastfeeding and is active every day. Is that a red alert?
Well, I won't say red alert, but it's certainly an alert of some sort. When you breastfeed, you produce quite high levels of prolactin to help you breastfeed, and that switches off the period. So it was not surprising if you are breastfeeding, that you don't have your periods. That's not so much of a worry. But you're right, if you are no longer breastfeeding and now you're a long time away from childbirth, then that does effectively, this is now amenorrhea of an uncertain cause. So I think, yes, it would be, for example, this person, if this is my patient, presenting to me, I would like, let's do some blood tests. Let's see what's going on with your hormones. What's happening? Are they switched off like the diagram I showed you? Have you got FHA, functional hypothalamic amenorrhea? Is there something else going on? Check the thyroid as well. Sometimes the thyroid can interfere with that. So definitely it is something that would need looking into to see if there's a medical cause. If there's no medical cause, in other words, all the blood tests don't show a medical reason, but they are low, the female hormones, i.e. FHA, then absolutely we talk about the details, nitty-gritty of exercise and nutrition, because it could suggest that there's an imbalance there.
And should I be adapting? Sorry, I've got the whole family in the room. Should I be adapting my clients' training in the meantime until I have those results?
I think there's no harm. I think that if I were, yes, practically, I would be discussing about the nutrition and the training. And if already I can see that there's an easy gain here, the blood tests are just like an extra little bit, just to be sort of, what's the expression, dot the I's across the T's and all that sort of thing. All right, so that's why, just to make sure. But absolutely, while you're waiting for those results, especially if she's told you that she's doing the dreaded fasted training and not having a rest day and not eating carbohydrates, then actually the blood test will just confirm probably what that is. So definitely one can always get on the front foot and start doing this. And also for those, by the way, this question could be where you might not have easy access to blood tests. So just listening to the clinical history and just making a judgment call, it's only going to help by revising nutrition and training. So absolutely, I think go ahead and do that.
Great. Nicky, thank you. I think we'll stop.
Sure.
Stop here. But how are you going to select your two lucky winners? Do you want to make it random, or do you want to go through the questions and?
Oh, that's going to be very difficult, isn't it?
Yeah, because they're quite.
And I might have to, because they're all, listen, they were all fantastic. I want to say to everybody, thank you so much for your attention and for your amazing questions. And I'm sorry that we didn't get to answer all of these. But that's the way it is. But you can get in contact, or you can get my book anyway. And there will be some of the answers there. I think you're going to have to help me choose. Sorry to be slightly. Sure. I quite like one about the practical one about how do you put this into practice with 40 players, because that was actually quite
I'm sorry you can't choose that, because I'll be cheating, because I asked that question. And
oh, damn. Oh, I didn't even see. Oh, dear.
I'm getting the book. But sorry. I think that's fine. I think, Tanaz, do you want to just pick two lucky winners from the people who have asked questions? Actually, and help Nicky out.
For you, Aditi, Dr. Sanjana repeated this similar question. So
so Dr. Sanjana gets, I think she's
there you go. There you go. That's good, because that's the practical thing. That's and one about the pills, the hormonal pills, please.
Yeah, sure.
Because we covered. Who was the one person I answered that?
I think Piyush. Let's go one. Hi Piyush. I think so. Piyush was the one who asked you the hormonal question. So Piyush, you're the second lucky winner. And I think we said Dr. Sanjana, right?
Yeah.
Sanjana, can we see you so that Nicky can say hi and also
Well done.
yeah. Yeah, it would be nice to have a. Yeah, so there's Sanjana. So congratulations, Sanjana and Piyush. Both of you will get a signed copy from Nicky soon. We'll get in touch with you to get your addresses and get it to you. So thank you so much for participating. So I think, guys, we would love for Nicky to keep going.
Apologies, Aditi. Piyush and Dr. Sanjana, if you all could just drop a message in the chat with your contact number and email ID. So we will get back to you specifically on that, for the address. If you could just drop your contact number on the chat. Sorry, Aditi.
Yep. So thank you so much, Nicky, for spending time with us today. I think this has been a fantastic session, and we would love to kind of keep getting you back on maybe more specific things like RED-S and especially anemia, because that is something, anemia and menstruation, because that is something that is quite random, quite not random, but quite
Frequent.
Yeah, frequent in the country. And I think that's something, we can also explore. But thank you so much for your time. It's been fantastic chatting with you for the last 2 months. And we look forward to having you again. And thank you, everyone, all the participants, for being with us on a Sunday. I know everybody has their things to do, but you chose to kind of be with us. So thank you so much. And we will keep having these kind of sessions. We will also send you a feedback form and a post-workshop toolkit that Nicky has helped us make as well, which you can maybe use for your more practical kind of needs. But also please do fill up that feedback form. It really helps us in understanding what more would you like to learn. So thank you for everybody who participated and was here with us today. And thank you again, Nicky. Thank you so much.
My pleasure. Thanks so much, everyone. See you. Bye.
Bye. Have a good Sunday, everyone.